Custody.
I defer to Senator Budd.
Thank you, Senator, and thank you, Chair, and thank you both for being here today. So I sent a letter to NIH back on May 9th asking why taxpayer dollars were spent on a study entitled Psychological Functioning in Transgender Youth After 2 Years on Hormones, in which 2 participants tragically committed suicide. So I'm still waiting for a response from NIH on that letter. And Chairman, I ask for unanimous consent that I can submit my letter for the record. Thank you. Now, the researchers, they concluded that the study was a success, but they admitted also that they couldn't show that cross-sex hormones improved the psychosocial functioning for minors. So clearly, it looks like this was a real waste of taxpayer dollars. Even worse than that, it led or contributed to the suicide of 2 youth. So, Dr. Murthy, considering what I understand is your past support for providing cross-sex hormones to children, can you explain whether you think spending more taxpayer dollars on research into transgender procedures on minors will actually help children with the mental issues that we're discussing today?
Well, thanks, Senator Budd, for that question. While I was not directly involved in this study and I'm not familiar with it, what I will say is that it is important for us to study what measures may help improve the mental health and well-being of transgender youth, because what we see clearly in the data is that as disturbing as these rates of anxiety, depression, and suicide are, they're actually disproportionately higher among LGBTQ and youth, particularly transgender youth. And studies that help look to understand what interventions work to address those psychosocial concerns, I do think are important because this is a community that is struggling.
Thank you. A follow-up to that, are you concerned about causing sterility and infertility in children who receive these cross-sex hormones, and about the negative long-term impacts of these medical interventions on their mental health?
Well, Senator, I think whenever you have a medical intervention, it is vital to study both the short and long-term impacts on physical and on mental health. And I think that's where an investment of resources is needed.
So just to clarify, you say you would be concerned about the long-term and short-term impacts of these medical interventions on their health, their mental health?
Well, I think it's important for us to understand what those are through research, sir. So that's what I'm saying. And I think that this is a space where this is obviously a very complex area, and what we need to do here is what we do in other areas of medicine, which is to look to experts who have expertise in this area to put together the kind of guidelines that clinicians can then look at and then make the best decision for patients based on that individual circumstance, just like we do in other areas of medicine.
Thank you, and I would just hope that the medical community in their research would be very cautious here. I mean, we've seen an NIH study which contributed to the suicide of 2 individuals, so please be careful, is the message. I want to shift gears just a little bit back to social media. We know that children are being bombarded every day by unhealthy information on social media. Millions of children are suffering, as we've talked about, from anxiety and depression, loneliness, because of the addictive content on social media. There's an advisory, I think, that you issued on social media and youth mental health, and it discussed the increased use of social media by kids. So to what extent, Dr. Murthy, do you agree that social media is damaging to the mental well-being of children? How do you believe that we should address this?
Well, thanks for that, Senator. And my concern here is not just as Surgeon General, sir. It's as a doctor and as a parent. I have a 5- and 6-year-old children, and my daughter is 5. She's in preschool. And she came home a couple of weeks ago and asked my wife and me if she could post a picture on social media. She doesn't even have a social media account. We've never talked to her about social media, yet all of her friends are talking about this. And I do believe that while there are some kids who get benefits from their use of social media in terms of opportunities to interact with others, in terms of the opportunity to find a community online, whereas they may not have one in person, I do worry that for many children, the effects are in fact harmful and are contributing to the depression and the anxiety that we see among many young people, as well as issues with body image. In terms of what we can do, I think there is a lot we can do. Ultimately, this isn't all about what government can do. I think there's an important role, a critical role for parents here and for kids themselves. But I think what parents need is some support and help. And by establishing safety standards for social media that help protect kids from exposure to harmful content and from harassment and bullying and from features that seek to manipulate them into excessive use, I do think that we can help parents. We also need, as policymakers, I think there's also a role to require data transparency here. And researchers around the country, Senator, tell me that they've had a hard time getting the data from companies to fully understand the extent of the impact of social media. I'll lastly just say this, Senator, when our children get old enough to drive a car, or when they're small, like mine were a few years ago, we had to get a car seat for them, we don't tell parents, you know what, go inspect the tires yourself, check out the engine, make sure the frame is adequately strong, because we know that not all parents have the expertise to do this. They rely on us establishing standards and then enforcing those with manufacturers. These are incredibly complex platforms that are rapidly evolving, fundamentally changing how our kids see themselves and interact with the world, and parents need help here to interpret and understand their safety.
Good. Thank you both.
Thank you.
Senator Murphy.
Thank you very much, Mr. Chairman. Thank you for holding this very important hearing.